It's a good question because I've been in healthcare probably longer than anybody in Congress, except for a few people. So for me to go into Congress, I think, I said this to a healthcare attorney today, I said Barack Obama probably should be calling me. I mean, I have really, for any of you that know me, I've been in healthcare all my life. I came out as a CPA in the healthcare field. I still am doing consulting in the healthcare field. I owned and operated nursing homes for 18 years. And I can tell you that, number one, the way I believe we should fix our healthcare system, look, our healthcare system does need some changes made to it. Yeah. Number one, we need to bring costs down. All right, so how do you bring costs down? Competition. How do you get competition? You open it up across state lines. So I'm a big advocate of, you know, you need to drive competition into the system to bring the price down. Today, we have a system where you have 2 or 3. Some states only have 1 or 2 providers of health care. I mean, at least we're fortunate to have a little bit more. But you need to open that up across state lines and increase the competition.
Jim, how do you do that? I mean, what is preventing that from happening right now?
You know, it's interesting because today one of the major drawbacks in our healthcare system is that each state has certain things that are required. For instance, some states require that you cover pregnancy. Other states require that you don't cover pregnancy. So each state has its own idiosyncrasies that it has to abide by. The biggest barrier to opening that up is getting everybody on the same plane. And that's the biggest problem today. You know, Ohio's requirements in healthcare versus Indiana versus Pennsylvania are totally different. And you would almost have to come together and say, we are going to provide this standard policy across state lines. And then you've got to make sure that the states agree to it, because that is a state issue, not a federal issue.